what we'll look at now are the gluteal muscles, which are your butt muscles. And there are 3 gluteal muscles, the daddy bear, the mama bear, and the baby bear: maximus, medius, and minimus. Okay, I think we'll look first at gluteus maximus, and this is a really enormous, powerful muscle. It's actually the most powerful muscle in the body. And it's interesting, evolutionary, that the gluteus maximus got stronger as we became more vertical. So it's very much a muscle that is designed for propulsion once you're vertical. The gluteus maximus, so if I just pop the skeleton down, the gluteus maximus, what we have here is the sacrum, the pelvis, which is the ilium, and the spine. Now the gluteus maximus attaches along the rim of the iliac crest and then extends further along the sacrum. So it runs from here down, if I just lower that a tad, down into this area to about there. That's the beginning, that's the gluteus maximus. So the gluteus maximus starts from about here, runs across like that, and comes to about here. And that's running along the outside of the sacrum. It then runs like this, and it runs in the curve of the bottom, like that. Zhunk, like this, following the curve of the bottom. And it joins into a fascinating structure, which is here and running down your leg. It's the fascia lata. So the muscle itself joins into a thick fibrous band which runs down the side of your leg, so that the muscle itself, as it contracts, will pull your leg backwards, and so it's an extensor of the hip joint, and as such, its action, it's got a very firm attachment, bony attachment at the top, but at the bottom, the pull of the muscle isn't straight to the bone, but is modified by tension all the way up the femur here. Very fascinating muscle. So the muscle it works if you pull your leg backwards, so it helps you propel yourself forward. If you're sitting or squatting, as you stand up, the muscle that does the standing up or the propelling as you jump forward is your gluteus maximus. So it's a huge power muscle. And as you land, you would keep going forward, except your gluteus maximus will tighten and check rein any further forward movement. So these are the primary functions of this huge muscle. As a power muscle, it gets triggers, and the triggers can be troublesome, but it's interesting when you look at trigger points in myofascial problems in your body. The majority of trigger points occur in posture muscles that are primarily not power muscles, but posture muscles. So glute max certainly gets triggers, but they're not as often. When they're there, they're very troublesome. And the triggers, there are actually 3 triggers. The first is along here, which is in the thickest part of the muscle. So the trigger occurs around this area. The second is in the free edge of the muscle. So here, there. And the muscle itself, as a lot of the big, powerful muscles of the body, it has a free edge, like the latissimus dorsi, like your pectoralis major. These muscles, and like the trapezius, these muscles have a free edge, which is just how the design goes. So the second trigger is here, and the third trigger is further lateral, like that. Now, this trigger sits over the sitting bone, the ischial tuberosity. And one of the symptoms of trigger points in the glute max is that it's really uncomfortable to sit, because this muscle gets squeezed onto, this trigger gets squeezed onto the ischial tuberosity. So the way you treat glute max, and glute max is, because superficial muscle, is actually quite easy to find find trigger points. The muscle fibers run in this way, they curve around, and so if you're searching for the trigger, you're running across the long axis. You'll find, because it's a big strong muscle, you'll find absolutely easy to feel little guitar strings. Once you find the guitar string, you search for the trigger, you'll feel it as a thickening, and then you will treat it. And this trigger gives you pain locally and comes across the sacrum. This trigger also refers up and down slightly, and the final little trigger over the ischial tuberosity is local. So this trigger you find by actually squeezing and lifting the free edge, and you find the trigger in the free edge. This you find by pressing straight down and in. The treatment is, if we were to choose any, we'll choose this: ischemic pressure, finding the point, pressing hard enough to cause pain, backing off. He's breathing and relaxing. I'm slowly increasing the pressure. We're in eye contact, and gradually, as I push in, the trigger just dissipates under my finger. This one squeezing between, that one pushing directly on. You can use cold, and you start from the origin, run over the trigger, and you're wanting to include the pain zone, so you run like this, over the trigger, down to the insertion. You do 2 or 3 runs. Okay, then having done that, this muscle is an extensor, so the way you stretch it is you flex your leg. Can I ask you to hold this? You pull that as high up as you can go. Can you go further? That's very good. So you stretch it as far as possible, and then you can actually, you can actually do another run or 2 of your cold in maximal stretch. You take a breath in, holds his breath for the count of 6, breathe out, and then you just don't breathe in again, and gradually you should be able to increase the stretch of that muscle using, there we go, that's nice, using post-isometric stretch. Great. And then you relax. We bring heat, pop the wheat bag on, leave the wheat bag on for a good 5 to 10 minutes so that you've got a nice red bottom, and then you do the same stretch again. So now we're talking about the middle-sized gluteal muscle, gluteus medius, a big deal cause of trigger points. Very common. This is a posture muscle. So the gluteus medius, if we lie like that, the iliac crest is here. Here's his iliac crest. And the second major structure is the greater trochanter of the hip. the greater trochanter is just here, and I'm going to draw it as a round bump. So the gluteus medius starts from behind the maximus. So maximus actually covers part of the medius. It attaches to the inside of the crest across to there. Here to here. It's a fan-shaped muscle, and it runs down like this to attach into the greater trochanter of the femur. It's quite a broad attachment. In fact, there are fibers that run this way, and then there's another part of the medius which comes even back further, and that runs quite horizontal. And so if you were a normally trained doctor in most medical schools around the world, you would not, in fact, be aware of these trigger points. And the fact is that they're actually really, really common. And so you would have somebody who had this pain running down their leg or running down the back or the side of their leg, and you would assume from its pattern that this was sciatica arising from a disc prolapse. You would do an MRI, and the MRI would be completely normal, which would then leave you very puzzled, and you wouldn't actually know what to do. Whereas if you had this knowledge that this little muscle has these two sets of triggers, and these triggers create pain in exactly the same distribution, you would be able to, with your hands, find the triggers, treat the triggers, no need for expensive investigations, and the person, after a few treatments, would be pain-free. This is exciting and is very empowering. Because this muscle is shaped like a fan, the fibers are coming from different angles. The fibers from the back will abduct the leg, but they'll also extend the hip because they're pulling from behind. So if you wish to stretch this muscle, what you do is, can I take your leg, bend it, and you drop right over there, drop it down. So you drop the leg down over the other side of the bed, holding his pelvis, and you can see as your leg drops down, so you will get the back fibers stretching. If you want to stretch the front fibers, can I take your leg again? Then what you do is you extend the hip and drop it down the end of the bed there, and in so doing, you will stretch the front fibers. And to treat the muscle, you stretch them all. But the most important thing is to pick where the trigger actually was, and that's the area that you're really going to focus on. Now, as you do your stretch, you use neuromuscular technique, and so you would take a breath in to the count of 6, breathe out, keep counting, 7, 8, 9. By about 9 or 10, the whole leg will just start to drop, and the muscle will continue to stretch out to length. Then you apply a hot pack to the muscle and repeat the stretch. So now we're looking at the little gluteal muscle, the gluteus minimus, and the medius attached to the crest and ran down to the trochanter. The minimus is just a smaller muscle. It also attaches in this kind of curve to the inside of the iliac crest. Deep, the medius is over it, and then deep to that is the minimus, and it then runs like a fan down to the same point but deep to the medius. So you've got the medius above, attaching to the trochanter, the minimus below, about half the size, half the bulk, half the power. Its functions are the same as the medius. It helps abduct the leg if you're standing on the opposite side. If you're standing on this side, it works together with the medius to stabilize the pelvis so that it doesn't drop as you put your weight on this leg. Again, primarily a posture function. The minimus is absolutely fascinating because there are two sets of triggers. The first set of triggers are vertical. They occur here and here. And if they are activated, you feel some pain in your lateral buttock, but the pain is then referred in a thin band down your lateral leg. It misses the knee and then continues down your leg almost to your ankle. And so this mimics radicular or sciatic pain. And the distribution of the pain running down the outside of your leg mimics the sciatica arising from the L5 nerve. Then there are a second set of triggers, and they run along, very similar to medius, they run along the top of the muscle, and these refer into the buttock and down the back of the leg, ending in the mid-calf. So this fascinating, completely different and complex, and for a lot of people very confusing pain reference zones, because they mimic the S1 distribution of sciatic nerve distribution. Okay, the way to find these triggers is they're difficult because they're deep beneath the gluteus medius. You know that they're minimus triggers because of their distribution, because the medius triggers, if you remember, mimicked low back pain. These mimic sciatica, and they're lower down. You have to push far deep through the medius, but when they're active, they're super tender. And what is also really interesting is that by pressing on them, quite often you will turn on the pain in their distribution. So you have to press firmly. I tend to use my thumb. I support it with the other thumb. I press down, and the person says, and I'm running across the long axis of the fibers. I find the tight band, search for the trigger. Once I've found the trigger, we follow ischemic principles with pressure just below the pain threshold, and then gradually increasing the pressure until the trigger melts away. Using cold, you would start at the origin, and here this makes much more sense. You would start at the origin, over the trigger, into the insertion, down the pain distribution zone, and then you do 2 or 3 runs. Then you stretch the muscle, and just like the medius, there are muscle fibers that are in front, and there are muscle fibers in the back. If the triggers are in the front, you will extend the hip and drop it down. So can you lean your body forward like that? And if the triggers are at the back, you will flex the hip and drop the leg forward, stretching it out like that. And then heat and repeat the stretch. So there you are. We've looked at all these three muscles, and what's so interesting about them is that the pain reference zone is so markedly different in muscles that have the same functions and virtually the same anatomy. So this is one of the amazing things and confusing things about myofascial pain. Once you understand it, you have such power. Until, if you didn't know of these triggers, the vast majority of doctors would be doing an MRI to look for a disc prolapse and pressure on a nerve. And when they found, if they didn't find it, they wouldn't have an answer. Whereas somebody who understands this, who's got good hands, can find the triggers, can treat those triggers, you have cured that person.